And now we're called for the second presentation, Virtual Reality Enhancing Pediatric Vitality. And who will speak about it is Jala Sary, Shaza Elbaroucy, Omar Hegazy, and Zyad Ibrahim. Yes. And these are our brilliant students from New Giza University.
Good morning, everyone. Thank you for joining us. It's our pleasure to be among you today. My name is Shaza, and these are my colleagues, Jala, Omar, and Zyad. We're fifth-year medical students in New Giza. We are very excited to dive into an innovative and rapidly evolving field, which is the use of virtual reality in pediatrics. But before we dig deep into our topic, we have a question for you. Who has struggled studying anatomy before?
Yeah.
Exactly, who hasn't?
Yeah.
Like, do you have any reason why you were struggling, or? Exactly.
And the old methods that we used to is depending in the best on a 2D image, which are drawings. So the imagination of the environment of the anatomy was not the best that we had.
There are several reasons why studying anatomy could be challenging, whether it's the complex terminology or having to relate different structures of the body to each other. Or maybe you're just a visual spatial learner.
Now, what is a visual spatial learner? That's basically an individual who prefers to be perceiving information in a visual or a spatial manner where they can then understand and remember clearly the visual and spatial relationships between concepts and objects. They tend to think in images rather than words. Okay. Now, one of the other reasons why someone might have difficulty as well is what's called aphantasia. If I come to ask you guys to think of a red apple, some people will have a perfectly clear image of a red apple. However, others will only know that they're thinking of a red apple but will not have an image to it. This is when you realize you might be having aphantasia. Now, as you can see here, there are grades to aphantasia, but our aim here is to tell you that it's one thing to be able to think about a structure and a total other thing to visualize it and understand it completely.
Immersive technology is now being used to overcome all these struggles and also enhance our patients' vitality, which we will get to in a couple of minutes. Immersive technology refers to the technology that creates a sense of perception by stimulating multiple senses. For example, using your sight, using your hearing, or even sometimes touch. And it includes different forms. We have augmented reality, virtual reality, and mixed reality. Augmented reality is a digital layer over physical elements, which is what we use in Instagram and Snapchat. Virtual reality is basically when you immerse yourself fully into an environment, while mixed reality is a mixture of both.
Now, VR has emerged as a very powerful tool in the field of medicine, from offering solutions to education, to training, and even patient care. It enables opportunities for learning, practice, and treatment in various medical disciplines.
It also facilitates preoperative planning by allowing surgeons to visualize their patient's anatomy and having to do complex procedures in a completely risk-free zone. They also offer promising avenues for pain management, rehabilitation, and mental health treatments to reduce anxiety and improve patients' outcome through relaxation technology and distractions.
Hello. So me and my colleagues are going to talk to you about 3 different aspects of how we can use VR in pediatrics. I'm going to talk about the first aspect, which is preoperative planning using VR. So our patient is a 28-month-old girl who was diagnosed with Swiss cheese ventricular septal defect at the age of 5 months, and she went through multiple unsuccessful operations. The first operation was a surgical approach that was complicated at day 7 with a right ventricular trabeculations, and the second operation was an attempted to a transcatheter closure of a residual large apical VSD. So after that, a decision was made to try and understand the anatomy of the patient's heart more accurately by using VR technology. So first, our patient was referred for a cardiac MRI. As the cardiac MRI shows a large anterior muscular defect and 2 small mid-muscular defects. Then the data from the cardiac MRI was reconstructed into a 3D model, as the model shows here, and to the doctor's surprise, the defect they were trying to close is actually highlighted by the red asterisk, was actually an opening to a false lumen connecting to the actual defect, highlighted by red and a black star. So the opening was connected to the actual defect through a false lumen. So after that, the files from both the cardiac MRI and the 3D model were imported into a software to make a VR model to help doctors with preoperative planning. And now we can have, I can show you the video of the process. ما في صوت. ممكن حد يشغله هنا. حد يعمل لا مش عارف. خلاص مش مشكلة. It's fine.
I think here we are seeing the tunnel that you're talking about inside the right ventricle.
Virtual reality. This was the site chosen for the.
Okay. As if we are inside the heart with a camera. So this will give us the exact idea about the inlet and the outlet of the defect and the quality of the tissues surrounding the defect and the optimum method to close this defect, whether it's transcatheter or surgical.
An open surgical approach, yes.
Okay. So these are excellent method to truly imagine the defect and the way to treat it.
So after reviewing the VR model by both teams, the surgical and interventional team, finally a decision was made on a hybrid transcatheter and open surgical approach. So for the procedure itself, a right ventriculotomy was done right below the pulmonary valve in the infundibulum. And then the right ventriculations were divided to better visualize the actual defect, the ventricular defect, posteriorly to the false defect mentioned before. And then the large ventricular defect was closed using a Dacron patch. And the previously created 3D files and the VR model helped doctors to highlight 2 main aspects, which are proper exposure of the largest VSD through the right ventricular trabeculations and precisely locating the incision site in the right ventricular outflow tract. So in conclusion, viewing the VSDs in virtual reality allowed the team to not only locate the place of the defect, but also to precisely plan the right ventricular incision site and to visualize the muscle bundle that needs to be divided in order to better visualize the defect, and to decide on a hybrid transcatheter and surgical approach to ensure success repair. And now my colleague is going to walk us through the second aspect of our presentation today.
Our second topic is about pain management. Here we have a study done on burn pediatric patients. It's a study that included several studies done together to assess the effectiveness of VR. On our first case, we have 18 burn patients which showed decreased opioid requirements during their procedural dressings. It was reported that the pain decreased by 30 to 35% when immersed in a fully distracting VR environment. The second case showed 57 burn patients who had their hands burned, and the results showed the rehabilitation, like they had to go through rehabilitation before and after. They evaluated before and after rehabilitation. The VR group demonstrated better results on pain, activities of daily living, work and satisfaction scales.
The last case on pain management were on 48 pediatric burnt patients with more than 10% total body surface area. They were already being treated pharmacologically. However, half of them were immersed in VR. And it showed that those who were immersed in VR, along with the pharmacological treatment, showed lower pain scores using the graphic rating scales.
Okay, so now we will shift to another use of virtual reality in medical practice, which is medical training. It's a very important aspect. As my colleagues already said, we have different abilities, different visual spatial abilities, and different levels of imagination. And that's why some people may find it way more challenging when studying cardiac anatomy, especially on 2D models. The specific anatomical defects and the subsequent pathophysiology may be way more imaginable and easier to comprehend when studied on 3D models, as doctors will have the ability to the ability to interact with physiological and anatomical structures, and that may improve their surgical performance. And that's why the study I will discuss today in medical education. The objective of the study was to systematically compare the perceived subjective effectiveness of VR and 3D printed models in the educational experience of residents and nurse practitioners. The study was done in Seattle's Children's Hospital in the United States. They got 2 patients from the hospital's database, one of a developmentally normal heart and one of a tetralogy of Fallot. They used the CT and MRI images in order to generate 2 pictures or 2 models, one the 3D printed one and the other the virtual reality. And these are the pictures. The one on the left, on the top, is the normal developmental heart with the virtual reality model, and the one in the bottom is the 3D printed model, and the one on the right, they are both VR images of the tetralogy of Fallot. 27 medical residents and 3 nurses had the ability to have a 15-minute session training with both models of them. They had minimal previous exposure to both models, and they were introduced on how to use the technology of virtual reality. Subsequently, they completed a survey offering binary summative assessment and responding to Likert scale questions in order to compare the effect of each model in understanding cardiac anatomy and pathophysiology, and those are the results. Most of them had previous minimal exposure, as I already said, to both models. Participants endorsed a great degree of understanding with VR models compared with 3D printed models and other traditional structures. Most participants felt comfortable with modern technology, and 87% has preferred the virtual reality model over the 3D model. And that's a graph showing the results. And these are some statements that they said after finishing the survey. Virtual reality made it easier to visualize the heart from all planes. 3D printed models was more restrictive. And another one has thought that seeing the 3D printed model helped him differentiate normal versus abnormal structures. And they also said that being the 3D printed model being colored has made it easier for them. In conclusion, overall, virtual reality was preferred over 3D printed model by pediatric residents and nurse practitioners for understanding cardiac anatomy and pathophysiology. But of course, the study had some limitations, such as small sample size. There were only 30 medical residents and nurse practitioners. Learning preferences are subjective. The group was primarily composed of medical residents, not surgical residents, which may have benefited more from that study. And maybe including more complex lesions in the future, more complex than tetralogy of Fallot may be more beneficial, and asking more specific anatomical questions in the assessment would make it more precise. And when comparing virtual reality to other modalities, it had many advantages. As it can navigate and interact with the environment, it's highly engaging, and it creates a true sense of depth and spatial relationships, and it can experience real-time responses to their actions.
As much as there are many advantages to VR, there are also some limitations. For example, setting up and maintaining a VR system would require technical expertise, it's expensive to implement, and also there were some ethical concerns related to the patient's privacy, information, consent, and data security. And it can also not really always be accessible to patients in rehabilitation.
Now, despite the VR's limitations, VR offers unique advantages such as immersive learning experience and patient engagement. While challenges and ethical considerations remain, continued research and innovation are essential to overcome these barriers and unlock the full VR potential in transforming the practice of medicine to the better. Thank you.
We would like to thank Dr. Eman Emil, Dr. Mohammed Omar, and Dr. Ahmed for this opportunity, and also Dr. Antoine for guiding us through this, and our doctors. It was a pleasure having you.
أحب أشكركم جدا جدا على البرزنتيشن دي، على طريقة البرزنتيشن، اختيار الموضوع كله كان هايل الحقيقة، وهو ده المستقبل يعني إن شاء الله. ميرسي.